Hey everyone, and welcome back for another deep dive. You know, as a medical microbiologist, you're probably pretty familiar with trichomoniasis.
Oh, for sure. Definitely comes up in the lab.
But today, we're going to be looking at it through the lens of the World Health Organization's 2022 Aware Guidance for Sexually Transmitted Infections.
Okay.
Specifically, we're going to be focusing on trichomoniasis management. And even though this might seem like old news, I think you'll come away with some new perspectives.
Yeah, there's always something new to learn with infectious diseases.
Totally.
I mean, even with the ones that we see all the time.
Exactly.
Like trichomoniasis, guidelines are always changing, and so is our understanding of them.
Absolutely.
Yeah.
So why don't we just start with the basics? Like, what exactly is trichomoniasis?
So trichomoniasis, it's a sexually transmitted infection, and it's caused by this protozoan parasite Trichomonas vaginalis. It's actually just a single-celled organism, but, despite its tiny size, it can cause a lot of problems.
Oh, yeah, for sure. And it's a sneaky one, too. A lot of people don't even have symptoms.
Right.
Especially men.
Yeah, it's one of the trickiest things about this infection. A lot of men, they don't even realize they have it, so they can easily spread it without knowing.
Wow.
But when women have symptoms,
Yeah.
they can have a pretty specific set of issues.
So let's talk about that. Like, what are the main signs of trichomoniasis in women?
So typically what happens is the vagina gets inflamed. And a lot of times there's this discharge, kind of frothy, and it has a bad smell. And along with the discharge, they might have what we call dysuria, which is basically pain when they pee.
Right.
And some women even experience pelvic pain.
Oh, wow. So not fun.
Yeah.
Are there any symptoms that men should be aware of?
Yeah, men can definitely have symptoms too.
Okay.
It's less common, but it does happen.
Okay.
Some men will notice a discharge from their urethra, kind of like with other STIs.
Right.
They might also feel pain when they pee, and some have discomfort in their testicles.
So given that so many people don't have symptoms,
Yeah.
how do we even diagnose trichomoniasis reliably? I mean, as a microbiologist, what are the tools you would use to find this parasite?
That's so important. You're right.
Yeah.
We need to catch it even when there are no obvious symptoms.
Right.
And it's also really important to remember that anyone who's diagnosed with trichomoniasis, they should get tested for other STIs too, because co-infections are pretty common.
Right.
When it comes to lab tests, we have three main methods: wet mount microscopy, nucleic acid amplification tests, asavionidates, and culture.
Okay, let's break those down a little, starting with wet mount microscopy.
Okay.
I imagine that's a pretty standard approach.
Yeah, it's pretty common, and it's relatively inexpensive and easy to do.
Okay.
Basically, we take a sample of either vaginal discharge or urine and look at it under the microscope to try to see the trichomonads moving around.
I remember from training that the trichomonads don't stay active for very long.
Exactly. That's the biggest problem with wet mount microscopy.
Oh, okay.
To identify them, they really have to be moving.
Yeah.
And they stop moving pretty quickly. So you have to read the results within about 10 minutes of preparing the slide.
Wow, that's pretty fast.
It is.
What about gnats? I feel like they're becoming the go-to for a lot of STIs.
Yeah, for sure. They're really sensitive and specific for Trichomonas vaginalis.
Okay.
Gnats basically amplify the parasite's DNA.
Okay.
So we can find it, even if there's not much of it there.
Oh, wow.
And the great thing about gnats is that we can use different kinds of samples,
Oh, cool.
like vaginal swabs, urine, even semen.
That's really convenient.
Yeah.
Is it easy to get gnats done everywhere, though?
Well, they're not as widely available as other tests.
Okay.
And sometimes they can't be done as rapid tests, so that can be a bit of an issue.
Right, so then results can take a while.
Yeah,
Okay.
yeah.
And cultures, that's still commonly used?
Culture used to be more common, but it's not really done routinely anymore. Basically, we take a sample and put it on a special growth medium, and then we see if the trichomonads grow.
Okay.
It can take up to a week, though, to get results.
Oh, wow.
And, if you need to start treatment quickly to prevent it from spreading, that's just not ideal.
Yeah, makes sense. So speed is a big factor when you're choosing a test.
Definitely.
What about other tests? Are there any other lab tests that you would typically order if you suspect trichomoniasis?
Well, like I mentioned before, it's important to test for other STIs
Okay.
when you suspect trichomoniasis.
Yeah.
Apart from that, no, you usually don't need any other specific lab tests.
Okay, and what about imaging studies? Are those ever used for trichomoniasis?
Not usually, no.
Okay,
The diagnosis is mostly based on the symptoms and lab tests.
that makes sense. So we've talked about how to diagnose it. Now let's get to treatment. This is an infection we can actually treat right.
Absolutely.
Yeah.
Good. And something really important to remember is that we recommend treatment for anyone diagnosed with trichomoniasis, even if they don't have symptoms.
Oh, wow. So even if they're asymptomatic.
Yeah, because we want to prevent it from spreading and causing other problems.
Okay, that's a really important point. What's the standard treatment then?
The standard treatment, according to the WHO Aware guidelines, is metronidazole.
Okay.
It's an antibiotic that works really well against Trichomonas vaginalis.
For our listeners who are real sticklers for the details, what are the doses and how long is the treatment for metronidazole?
Sure. So the AWARE guidelines, they actually have two main ways to use metronidazole.
Okay.
The first one is a single 2-gram dose taken by mouth. That's the one we prefer because it's so easy and convenient for patients.
Right.
But the second option is a 7-day course, metronidazole,
Okay.
where you take 400 to 500 milligrams by mouth every 12 hours.
Okay.
And that one's sometimes recommended if we're worried the patient might not stick to the treatment or if the single dose doesn't work.
Right.
So both options are there.
Yeah, what makes a doctor choose one over the other?
Well, even though that single dose is a lot easier for patients, studies show that taking it for 7 days actually leads to more people being cured.
Oh, wow.
Which is really important, especially if the patient has had treatment failures in the past or if they have a condition that might weaken their immune system.
So you have to weigh the convenience against making sure the patient actually gets better.
Exactly.
Sure.
Finding that balance is key.
All right, so now let's zoom in a bit. How does this tiny Trichomonas vaginalis even cause all these problems?
Basically what happens is, during sex, the Trichomonas vaginalis attaches to the lining of the urogenital tract.
Okay.
And that sets off an inflammatory response.
Okay.
Which leads to all the discharge and itching and discomfort that a lot of people experience.
So like a tiny invasion that it triggers this big inflammatory reaction.
Pretty much, yeah.
Wow. Okay, so let's zoom out now and talk about how widespread this infection is.
Okay.
How common is trichomoniasis?
Trichomoniasis is the most common curable STI in the whole world. To give you an idea, the WHO estimated that there were 156 million new cases globally just in 2020.
156 million cases.
Yeah.
Wow. Okay, so that's a lot.
Yeah.
Are there any groups of people that are more likely to get it?
While anyone can get it,
right,
it's definitely most common in women, especially women over 40.
Oh, interesting. I wouldn't have guessed that.
Yeah.
What happens if someone has trichomoniasis and they don't get treated?
That's an important question because if you leave it untreated, trichomoniasis can actually have some pretty serious consequences.
Okay, like what kind of consequences?
For your health.
Yeah.
One of the major concerns is that it increases your risk of getting HIV.
Wow.
And studies show that people with trichomoniasis are more likely to get HIV, and they're also more likely to pass it on to others.
Okay, so that's a major public health concern.
Absolutely, especially when you think about the global HIV epidemic.
Right. Are there any other problems that can come from untreated trichomoniasis?
Yeah, there are actually. It can also lead to complications during pregnancy.
Oh, no.
Women who have trichomoniasis during pregnancy, they have a higher risk of going into labor early, having their water break too soon, and their babies might be born with a low birth weight.
Oh, wow. So it's not just about the individual. It affects their future, too.
Exactly.
Before we move on to our quiz, I want to make sure everyone's on the same page. Just to clarify, what causes trichomoniasis?
So the only thing that causes trichomoniasis is Trichomonas vaginalis.
Okay.
No other organism can cause this particular infection.
Great. Now we're going to put your knowledge to the test with a few exam-style questions. Don't worry, this isn't graded or anything.
Okay.
It's just a fun way to see what you've learned.
Sounds good.
Okay, so first question. What's the most sensitive test that we have right now for diagnosing trichomoniasis?
The most sensitive test is the NOW.
Right, the nucleic acid amplification test.
Yeah, it's really good at detecting Trichomonas vaginalis DNA.
Yeah.
Even when there's only a tiny amount.
Excellent. Question number 2. Which of these is not a typical symptom in women with trichomoniasis? Is it A, frothy vaginal discharge, B, fever, C, dysuria, or D, pelvic pain?
The answer is B, fever.
Yeah.
Trichomoniasis can cause a lot of uncomfortable symptoms, but fever isn't usually one of them.
All right, true or false? Treatment for trichomoniasis is only recommended for people who have symptoms.
That's false.
Okay.
Remember, we want to stop it from spreading.
Right.
So we recommend treatment for everyone who has it, even if they don't have symptoms.
Good catch. Now, for a bit of a trick question, how else can you get trichomoniasis besides sexual contact?
That's an important one.
Yeah.
A mother can actually pass trichomoniasis to her baby during childbirth.
Oh, wow. Okay. Last question. What's a major public health concern that's linked to untreated trichomoniasis?
The big concern is that if you don't treat trichomoniasis, it can make it easier to get and spread HIV.
Right, and that's a serious problem,
Definitely.
especially considering how many people are affected by HIV worldwide.
Abs-
So early detection and treatment are crucial.
yes, very important.
Wow, that quiz really shows how complicated this infection can be.
Yeah.
It seems simple at first, but there's so many things to consider, especially with those cases where people don't have symptoms and the impact it has on public health.
Yeah, and this is a great example of why microbiology is so important.
Hmm.
I mean, we're not just looking at these tiny organisms under a microscope.
Right.
We're trying to figure out how they affect people, both individually and as a population.
Absolutely. And as medical microbiologists, our listeners are right at the heart of that.
Yeah, exactly.
So what are the key takeaways here for our listeners? Like, what's the most important thing for them to remember?
Well, first of all, trichomoniasis is really, really common.
Right. We saw those numbers.
You're going to see it a lot in your work.
Yeah.
But the good news is it's easy to cure if you treat it properly.
Okay. That is good news.
The tricky part is finding those silent infections,
Yeah.
especially in men who often don't have any symptoms.
Right.
Right.
So we need to be really good at diagnosing and treating it, not just for the individual patient, but to stop it from spreading in the community.
And we also need to think about testing for other STIs.
Oh, absolutely.
Since co-infections are so common, we need to look at sexual health from all angles.
For sure. Testing for other STIs should just be routine whenever trichomoniasis is suspected.
Yeah.
And we can't forget about the long-term problems it can cause if it's not treated,
Right.
like the increased risk of HIV and complications during pregnancy. All of these things highlight how important it is to have good screening and treatment programs in place.
From your experience, what are some of the biggest obstacles you've encountered when dealing with trichomoniasis, considering how many people have it without knowing?
Honestly, one of the biggest challenges is just making people aware of it.
Okay.
Both healthcare providers and the general public.
Uh-huh.
A lot of people don't even know trichomoniasis exists, even those who are sexually active.
Yeah.
That makes sense. If people don't know about it, they're not going to ask to get tested.
Exactly. And that can lead to late diagnoses and missed opportunities for treatment.
Right.
So we need to make it okay to talk about sexual health and encourage people to get tested regularly. It's not just about taking care of yourself, it's about protecting everyone.
So education is key, but what about access to testing? Are there any barriers there?
Yeah, access to good quality testing can be a problem, especially in places where resources are limited.
Okay.
And NETs are great,
Yeah.
but they might not be available everywhere. And even when they are, they might not be available as rapid tests, which means waiting longer for results.
Right, and that can delay diagnosis and treatment.
Exactly.
Okay, so we have the awareness challenge and the access challenge.
Yeah.
What about treatment? Are there any problem with that?
Metronidazole usually works well,
Okay.
but we are starting to see cases where the treatment doesn't work and some signs of drug resistance. This means we need to keep looking for new treatment options, especially as this parasite keeps changing.
That's a good point. It reminds us that infectious diseases are constantly evolving,
Exactly.
and we need to stay ahead of the game.
Yeah.
Any other challenges with treatment?
Making sure patients actually take the 7-day metronidazole course is another challenge.
Oh, yeah.
The single dose is more convenient, but the longer course has better cure rates.
Yeah?
But getting people to take their meds for a whole week can be tough,
Right.
even if they know it's important.
Yeah, people want a quick fix,
Yeah.
even when it comes to their health.
So we need to do a better job explaining why the longer treatment is better and stress that they need to finish all the doses, even if they feel better before the week is over.
So we've talked about the challenges with awareness, testing, and treatment. But what about preventing trichomoniasis in the first place? What can we do to stop it from spreading?
Prevention is always the best approach.
Of course.
Comprehensive sexual health education is really important. We need to give people the knowledge and tools to protect themselves and their partners.
Definitely. What kind of information should be included in this education?
It needs to cover everything about sexual health,
Okay.
not just STIs. We need to talk about using condoms, getting tested regularly for STIs,
Right.
and how to talk openly and honestly with partners about sexual health. And it needs to be inclusive and relevant for everyone, regardless of gender or sexual orientation.
And these conversations need to happen outside of the doctor's office, too.
For sure.
How can we reach people in their communities and make this information more accessible?
We need to team up with schools,
Okay.
community organizations, and public health agencies to get these messages out there.
Right?
And social media and other online platforms are great for reaching younger people.
Absolutely. It's not just about the information itself.
Yeah.
It's about making it interesting and engaging for the people you're trying to reach. What about healthcare providers? What can they do to help with prevention?
Healthcare providers are in a unique position to make a difference.
Oh.
They can educate their patients,
Yeah,
counsel them, offer testing, and answer any questions they might have.
right.
It's all about creating a safe space where people feel comfortable talking about these things.
So it's a multi-pronged approach.
Exactly.
Education, open communication,
Yeah.
and practicing safe sex.
Yeah.
But we know that even with the best prevention efforts, infections are still going to happen.
That's true.
What can we do to improve screening and diagnosis, especially for those who may not have easy access to healthcare?
That's a really important question, and we need to be creative and proactive in our approach to reach those most at risk.
So what are some ideas? How can we improve screening and diagnostics, especially for these vulnerable populations?
One thing we could do is make rapid point-of-care tests for trichomoniasis more available.
Okay.
Imagine getting results within minutes.
Like a rapid HIV test?
Exactly.
Okay.
Think about offering these tests in places like community clinics, outreach programs, even pharmacies. That would make it much easier for people to get tested.
Yeah, that would be amazing. So much easier and more convenient.
And we can use technology to help us too.
Okay.
Telehealth and mobile health platforms are growing rapidly.
Yeah.
We can use these tools to reach people in remote areas,
Yeah.
provide virtual consultations, and even track whether people are taking their medication as prescribed.
So meeting people where they are and making healthcare more accessible.
Exactly.
Yeah, technology can really help overcome those geographical and logistical barriers.
Right.
Especially when we're talking about an infection that can be asymptomatic, like trichomoniasis.
For sure. And we can't forget about working with the communities themselves.
Right.
Partnering with trusted organizations and leaders within those vulnerable communities is essential. We have to build trust and tailor our approach to fit their specific needs.
Community engagement is so important. It's about building relationships and working together to solve public health problems.
Yeah.
What about research? What role does research play in improving screening and diagnostics?
Research is absolutely crucial.
Okay.
We need to keep investing in studies that explore new diagnostic methods, different treatment options,
Right.
and better prevention strategies. The more we know about trichomoniasis, the better equipped we'll be to fight it.
Yeah.
And it's important to remember that this research needs to be inclusive, reflecting the diverse experiences and needs of different groups of people.
This deep dive has been incredibly insightful.
It has.
I feel like we've gone beyond just the basic facts and really explored the complexities of this infection from different perspectives.
It's been great diving into this topic with you, and I hope our listeners have found it as interesting and thought-provoking as we have.
Before we wrap up,
Yeah.
I want to leave our listeners with one final thought to consider. We've talked about how common asymptomatic cases are, the potential for serious complications, and the challenges in reaching certain groups.
Yeah.
So what innovative solutions can we as a global community implement to manage trichomoniasis more effectively and ultimately reduce its impact?
That's a great question to leave everyone with.
Yeah.
It's a challenge that requires all of us to work together, healthcare providers,
Yeah.
researchers, policymakers, and communities around the world.
Yeah. It really is a global effort.
It is.
It's exciting to think about all the potential for innovation and collaboration in tackling this public health challenge. I feel like we've covered so much in this deep dive.
Yeah, we have.
From the nitty-gritty of Trichomonas vaginalis all the way to broader implications for public health.
Yeah, and I think what's really come through is just how complex infectious diseases are.
Yeah, for sure.
It's not just about the bugs themselves.
Right.
It's about people's behavior, social factors, and access to healthcare.
Absolutely. It really highlights that microbiology is about so much more than just identifying those organisms.
Yeah.
It's about understanding how they affect individuals and populations and using that knowledge to actually make a difference in people's lives.
Exactly. And that's why I love this field so much.
Me too.
We can really have an impact on global health through our work as medical microbiologists.
I couldn't agree more. And to our listeners out there, I hope this deep dive has not only given you a refresher on trichomoniasis, but also sparked some new ideas.
For sure.
And maybe even a renewed sense of purpose in your work.
I hope so too. It's been great chatting with you and with all our fellow microbiologists out there.
And to our amazing audience.
Yeah.
Thank you so much for joining us on this exploration of trichomoniasis.
Thanks, everyone.
We hope you found this deep dive informative, engaging, and thought-provoking.
We did.
Remember, knowledge is power, and by working together, we can really make a difference in the fight against STIs, like trichomoniasis. Until next time, stay curious, keep those microbes in check, and never stop learning.
See you next time.